Hey, Dr. Foster here in Lee Summit, Missouri. One of the questions we get, or one of the things we see a lot, are ingrown toenails here in the office. And people always ask, what can I do for recurring ingrown nails? Well, the ingrown nail happens when the nail actually grows in or penetrates the skin around the edge of the nail, and usually it becomes infected and it's pretty painful. So one of the things that we can do about that is to permanently remove a small section of the toenail. So typically, if this little edge of the nail grows in, it's this section of the nail that's going to be the problem. So we would take just a small section of the nail. That means we'd leave the rest of the nail. So cosmetically, it looks pretty normal. And once we take that little edge of the nail out, I just take an applicator like this and slide that down and apply that to what's called the nail matrix. So this little section of the nail doesn't grow back again. And instead of being a gap there, what will happen is the skin will grow up to meet this edge. So again, the toe looks pretty normal, just a little bit narrower than it was before as far as the nail plate. But this skin will be right here and the nail will stop, and so it doesn't curve way down into the edge anymore. And then you should never have a problem with this side of the toenail growing in. So after the procedure, it's really pretty straightforward. You just need to clean the edge of the nail daily. We use a little wound wash, a little antibiotic. Typically you'll take a little piece of gauze and just kind of wipe that edge out so you can get the drainage out. Then apply your antibiotic in a small bandage, just again doing that daily until it's resolved, and then you should never have to worry about that side of the nail bothering you again.